Ready?
Yes, we're ready.
Okay, let's continue with. Okay, the renal function, as I said, is important because our kidneys regulate the electrolyte balance. They regulate acid-base balance, and they excreted product, and therefore uh, calculate the renal function to monitor it. And you see here the prediction about the renal function, about glomerular filtration, creatinine, is in clearance, okay, and which is funded by National Function Foundation to estimate glomerular filtration rate from serum creatinine. And now this equation, you don't memorize this equation, but which parameter we take in consideration to calculate the creatinine clearance, as you see age, okay, the body weight, okay, and the gender. They are affect the measurement the creatinine clearance. Okay, as I said, clearance and the creatinine is a molecule which stored in the muscle, our muscle, and the amount of the creatinine varies by gender, okay, and age. That we have to take in account age and gender, and this is a equation that recommended by National Kidney Foundation to creatinine clearance. Okay, why we need to calculate glomerular filtration rates? Okay, we have many for that. Okay, to detect the onset of the renal insufficiency, just drug dosage for drug excreted by the kidney. Okay, if you use a medication patient, you have to sometimes take account the function of the kidneys. Okay, you cannot give the dose of the for to all your patients. Okay, the function of the kidney may be changed by the age. Okay, and therefore, if the drug eliminated via the kidney and you have a kidney failure, you have just the dosage for such patients. Okay, you also need to calculate glomerular filtration to evaluate the therapies instituted for patients with chronic renal disease. Okay, to document eligibility for Medicare reimbursement and end-stage renal disease. Okay, these are really important decision to make. Okay, by estimating filtration rates, and also accurate points for patients awaiting cadaveric kidney transplants. You also and need to calculate glomerular filtration rates. Okay. Cystatin the other substances that are using to measure renal function. Okay, it is inversely proportional to the glomerular filtration. The more you have a level glomerular filtration, the higher concentration of the cystatin. Okay, it is an endogenous product. Okay, if renal function is impaired, that means it will increase the blood circulation. Okay, as I told you, creatinine is important to determine and follow, to detect and follow the kidney functions. Okay. However, the amount of the creatinine based on the gender and the age of. Okay, uric acid is other way. Okay, is the breakdown product of the purinucleotides metabolism and can be measured hyperionized plasma, serum, and urine. Okay. 3 major diseases stayed associated with elevated plasma uric acids. These are good in catabolism of the nucleic acids, in cancer patients, in patients with chemotherapy and renal disease. Okay, if you measure high level uric acids, okay, these 3 conditions, okay, that most probably maybe the causes hyperuricemia, okay, of the uric acid. Good, okay, good catabolism of nucleic acid, which we see in cancer patients or patients with chemotherapy and renal disease. Okay, okay, renal damage and nuclear metabolism, chemotherapy contribute to increases serum uric acid levels. Maybe the most 2 causes of hyperuricemia. Okay, now again your turn. Which of the following consists with respiratory acidosis? Okay, metabolic acidosis, acidosis. We need to differentiate these 2 from each other. Okay, now go ahead and send your responses. Respiratory acidosis, as the name implies, is associated with the lung, with respiration. Okay, metabolic acidosis is related to metabolic dysfunction. Okay. Let's see. Higher partial pressure of carbon dioxide is correct answer. Okay. Carbon dioxide, okay. Okay. Respiratory acidosis, low level, okay. The correct answer, okay. The A, because, okay, the level of the carbon dioxide is regulated by lung. okay, via respiration. And that means the correct answer. Okay, the protein content of the diet will affect primarily the result for which of the following? The protein content of diets. Which of the following is the waste product of the protein metabolism? Okay, thank you. Urea or urea nitrogen is the correct answer. Good job, guys. No, next one. Expected creatinine clearance for a patient with chronic renal disease. Okay, a patient with chronic renal disease. Okay, how is changed creatinine clearance? Which function of the kidney we are measuring when creatinine? Okay, let's see. Okay, very high renal glomerular filtration. No, renal glomerular filtration will decrease. Okay, because you have chronic renal disease. Okay, very renal glomerular filtration. Okay, renal glomerular filtration is not functioning normally. Okay, the correct answer, the creatinine clearance is low. Okay, the kidney is not able to remove the creatinine from the blood because you have renal dysfunction. Okay, what does means renal glomerular filtration rate is also decreased. Okay. Okay, good. Not bad. Okay, which of following electrolyte is the chief cation in plasma and has the main function of maintaining osmotic pressure? Today, I usually get two answers. One of you only into the Zoom meeting. Okay, let's see. Sodium is correct answer. Good. Now, okay. Which following laboratory findings consist metabolic acidosis? Okay. Metabolic acidosis is low of pH. If it's metabolic, okay, which electrolyte will change? Let's see. Okay, if it is metabolic, bicarbonate is involved. Okay. If you have metabolic acidosis, carbonate is substances. Okay, to have metabolic acidosis, that means bicarbonate is decreased. Okay, if you have higher level of bicarbonate, it result metabolic alkalosis. Okay, if the acid-base imbalance is related to bicarbonate, that means it is metabolic. Okay, if you have low level of bicarbonate, that means you have acidosis, because bicarbonate is alkalic. You decrease bicarbonate and you cause acidosis. Okay, creatinine clearance is used to assess the which function of the kidney. Okay, glomerular filtration function is the correct one. Creatinine clearance, okay, indicator for glomerular function of the. Okay, now the most interesting topics we have now. Okay, lipids, as you know, is my topic of the research. Okay, a clear relationship has been demonstrated between plasma lipids and lipoproteins and atherosclerosis. This is most common information that there is association between plasma lipids and atherosclerosis and cardiovascular disease and coronary heart disease. Okay, now it's if you talk about lipids, okay, what does lipids mean? Okay, cholesterol, phospholipids, triglycerides, these all are lipids, but cholesterol, maybe triglycerides that we are talking today, which are circulated in our blood, okay, and they are related to either atherosclerosis or some other health issues. Okay, cholesterol found in human cell membrane. Okay, cholesterol is not bad. Okay, too much cholesterol is bad, because cholesterol to produce vitamin D, to produce some hormones. Okay, also cholesterol is a component of our membranes. Okay, and however, unfortunately, cholesterol is associated with atherosclerosis. Okay, it is other important issues, how the explain the mechanism of atherosclerosis, but it is not that we should discuss. triglycerides, okay, is other type of the lipids, okay. Hypertriglyceridemia is high level of the triglycerides is associated with pancreatitis. Okay, as you see, cholesterol associated with atherosclerosis. However, triglycerides is not associated with atherosclerosis directly. Okay, is associated with pancreatitis. Okay, is increased of the pancreatitis. Okay, if the patient's serum appears opaque and milky, the approximate expected level of the triglyceride is about 6 milligram per deciliter. Okay, a higher amount of the triglycerides may about 1,000 milligram per deciliter may cause diabetes, which threatening issues. Okay, therefore we need to be careful. Now, the major plasma lipids, cholesterol and triglycerides, circulate in plasma bound to the proteins transported as a complex, which is known lipoproteins. Okay, why they transported as lipoproteins? Because cholesterol and triglycerides are insoluble in the blood. Okay, they are hydrophobic, okay, and not able to dissolve in the blood, not to transport via blood because of their feature, hydrophobic features, and therefore they our body, this type of lipids, they packed as lipoproteins, as you see here, in the core of the molecule of the lipoprotein. We have hydrophobic lipids such as cholesterol, triglycerides, and surround phospholipids, okay, and protein, okay, to make them water soluble molecules, okay, and then be able to transport via blood circulation. Note there are 5 main type of proteins. These are chylomicrons, low density protein, intermediate, low density, and high density lipoproteins. Okay, and elevation of plasma lipid is called hyperlipidemia, and plasma total cholesterol is a risk factor for atherosclerosis. Okay, hypertriglyceridemia has been associated with pancreatitis, as you see in the inside of the vessel. Okay, how the atherosclerosis is developed. Okay, and narrow the vessels. Okay, if this is a coronary artery, that means it will narrow the coronary artery, and the coronary muscles and the heart won't be able to get enough oxygen or nutrients and die. Okay, now LDL cholesterol, okay, which is known bad cholesterol because it causes high level of the LDL cholesterol, which result in atherosclerosis, okay, and dietary cholesterol and saturated fat are the most common cause of the mild or moderate level of LDL. And oxidation of the LDL initiate development of the atherosclerosis. Okay, what does means not the level of the cholesterol only. Okay, the oxidation of the cholesterol may initiate atherosclerosis. In some patients, you may see the normal of the LDL cholesterol, but still they develop atherosclerosis due to oxidation of the LDL. Now, hypercholesterolemia resulting from increased level LDL may be associated with the following disorder, such as not only dietary or okay, endocrinopathies, disorders, okay, or hypoproteinemia, okay, such as nephrotic syndrome, because we transport lipids via proteins, okay, and hypoproteinemia may be also cause a lipid disorder, dietary excess, okay, with cholesterol-rich foods, and menopause with estrogen replacement therapy without estrogen replacement therapy may also cause lipid disorder and atherosclerosis. Okay, the reference values of the lipids for cholesterol, it should be below 100 milligram per deciliter. LDL cholesterol, HDL cholesterol, which is good cholesterol, okay, because it's remove cholesterol from the wall of the vessels, okay. LDL cholesterol, which is bad cholesterol, should be below 130 milligram deciliter, and triglycerides, okay, is the reference range for that is between 60 to 150 milligram per deciliter, okay. The risk factor for epidemic, okay, are additive, family history of premature coronary heart disease, current smoker, hypertension, diabetes mellitus, okay, and low level HDL, they may all cause a hyperlipidemia. Okay, these are risk factors for coronary vascular disease. Okay, not only dyslipidemia, as you see, age, gender, race, and the level of the lipids, obesity, diabetes, okay, disease of the liver, kidney, this also affect the level of the lipids, smoking history, and physical inactivity, okay, is multifactorial disease. Okay, these are recommendations for to prevent cardiovascular from National Cholesterol Program. Okay, you may them. Cardiovascular is okay. Okay, and the test that we are doing in order to detect and follow coronary heart disease, myocardial infarction. Okay, for that, we're taking a serial sampling for cardiac markers, and the current marker assay combination for diagnosis of acute myocardial infarction and myocardial are follow myoglobin, troponin, and creatinine kinase. Now, as you see in these diagrams, okay, the relative marker increase after myocardial infarction, okay, myoglobin is the earliest increased the marker, okay. Our troponin T persists at the highest, which is in red, highest concentration for the longest length of the time. Therefore, among these markers, troponin T is the most important one that we're measuring in order to diagnose myocardial infarction and to follow the myocardial infarction. Okay, the test that diagnose liver dysfunction or pancreatic dysfunction, we call liver and pancreatic testing. Okay, if abnormal biochemical tests of the liver dysfunction, such as a hepatocellular damage or cholestasis, okay, cholestasis and excretory function of the liver, biosynthetic function of the liver, okay? The test that we measuring in the clinical laboratory known as liver function test, okay? They may indicate a cell damage, okay? The damage of the liver cell or cholestasis, okay? The block of the choledoc duct and excretory function of the liver, okay, and biosynthetic function. As you see, ammonia is one of the byproduct of the protein metabolism, and it's converted to the urea via liver. Okay, this function may result in increase of the ammonia, which we call hyperammonemia. Okay. Okay, bilirubin is a end product of the porphyrin, end product of the hemoglobin breakdown, and bilirubin is consists of conjugated and unconjugated. Conjugated bilirubin is also known direct bilirubin. Unconjugated bilirubin is known as indirect bilirubin. Okay, in jaundice, okay, which is a classic symptom of the liver disease, the bilirubin level is increased. Okay, and the jaundice can be either hepatic, okay, which a problem within the liver, or prehepatic or posthepatic. Okay, in prehepatic, the transport defect involving release of the bilirubin bound to the plasma albumin, because the bilirubin is produced in the reticular endothelial cells due to after breakdown of the hemoglobin. then transported to the liver for conjugation. Okay, if any problems, it's receive liver, we call a prehepatic jaundice. Okay, and posthepatic jaundice is related to the defect in transporting of conjugated bilirubin out of the liver cells. We have problem with liver. The jaundice is non-hepatic jaundice. If is before the liver, we call prehepatic jaundice. After conjugation of the bilirubin, okay, the effect of the conjugated bilirubin is posthepatic jaundice. Okay, we also have neonatal jaundice, a deficiency of the glucuronil transferase enzyme, which conjugate bilirubin, causes a rapid buildup of unconjugated bilirubin to accumulate in a brain tissue and result in kernicterus. Okay, is life-threatening that we need to treat it as quickly as possible. Okay, a testing of the liver and pancreatic are enzymes, AST, aspartate aminotransferase, ALT, alanine aminotransferase, G, alkaline phosphatase, and amylase. Okay, these enzymes are essential function of the liver. Okay, and the function of the pancreas, as you see here, ACT, it is found primarily in the heart tissue. ALT, both enzymes is present in heart tissue and in liver tissue. However, AST, aspartate aminotransferase, mainly found in heart tissue. Alanine aminotransferase is found primarily in the liver, and this is a liver function test mainly. This is a heart function test. Okay, and glutamyl transferase is a marker for choledocholithiasis, okay, and alcoholism, and therefore we are GGT to diagnose either choledocholithiasis, okay, a stone in the bile ducts, okay, and also alkaline phosphatase, other enzymes, to diagnose both pancreatitis or a choledocholithiasis. And amylase and lipase, these two enzymes, are of pancreatitis. Okay, lipase is the more specific to the pancreas. Those amylase both secrete from pancreas and from salivary duct, salivary tissue. Okay, or lipase is only secrete and released from pancreas. For lipase is more specific to the pancreas. Okay, serum protein electrophoresis is that we performing in the clinical laboratory. There are 5 type of the that we see on the electrophoresis: albumin, alpha-1, alpha-2 globulin, beta globulin, and gamma globulin. We also measure protein in urine and spinal fluid. Increase in protein in the urine result from either glomerular or tubular function. Increase the total spinal fluid protein may be found in meningitis, infection in the brain may cause high level of the protein in cerebrospinal fluid. Okay, you see the serum protein electrophoresis here. Okay, coagulation tests such as prothrombin time is a function of the liver because it produces liver. Okay, and 3 diseases cause most of the pancreatic disease: cystic fibrosis, pancreatitis, pancreatic carcinoma. Okay, are 3 common diseases related to pancreas. Okay, other tests that we performing in clinical chemistry, there are tons of hormones, thyroid hormones, okay, adrenal hormones, hypophyse hormones, okay. As you see here, thyroid hormone, we have, we measure hormones to diagnose hyperthyroidism, like the low level thyroid hormones, hyperthyroidism, higher level of thyroid hormones are really important. Okay, there are tumor markers that we are measuring, and mostly to monitor the treatment of the cancer. Okay, some to screen for cancer, but most of them are marker used to monitor them only. As you see, the list of the most tumor markers here. Okay, you don't need to memorize tumor markers. Okay, but there are tons of the markers that we are using to monitor the treatment of the cancers or to monitor recurrence of the cancer. Okay, we also measuring some the level of the medicines, which is non-therapeutic drug assays, in order to see whether we have effective amount of the medicine in the blood circulation. Okay. Okay, we're also using the amount of drug of abuse, such as alcohol, marijuana, cocaine, benzodiazepines. There clinical chemistry analyzer. They measure tons of the drug of abuse levels in daily basis. Okay, now I have a question for you guys, and we will finish with these questions. Okay, in a premature newborn, a deficiency of what enzyme can affect the conjugation of bilirubin glucuronide in the liver? The enzymes which associated with with conjugation of the bilirubin in the liver. Okay. Let's. Okay, glucuronide trans enzyme which conjugate bilirubin, okay, with added glucuronic acid, bilirubin. This undissolved molecule become dissolved in the blood circulation. Okay, good. What is the classic symptoms or manifestation of the liver disease? Okay, hemolysis of red cells, jaundice, kernicterus, formation of the gallstone, none of above. Okay, the indicator that you will see, okay, jaundice is the one of the classic symptoms of the liver disease. Good. Okay, which cardiac marker persists highest concentration for longest length of time? In CMB, in T, troponin I, none of the above. Okay. Troponin T is the correct answer. Okay. These all are cardiac marker, but troponin T persists at highest concentration for the longest length time of the time. Okay. Myoglobin earlier, but not persist at highest concentration for a long time, and is non-specific because myoglobin may be due to the damage of muscles. Okay, a complex molecule circulate in plasma bound to protein and transport lipids is known as the transport form of the lipids is known as lipoprotein. Correct. Okay. Okay. The lipid result will be falsely elevated in a blood specimen, specimen drawn by non-fasting patients. If you withdraw a blood patient from patient with a non-fasting, which of these will be affected? This is really important information, okay, to know as a physicians, as a healthcare provider, okay, in order to reduce the errors, laboratory pre-analytical errors. Okay, triglycerides is affected via diets, others not, does not, okay. Okay, the last one. Which of the type cholesterol is known as bad guy. Last question. Whoa. Okay. Okay, bad cholesterol is LDL cholesterol. Good. Now I am going to stop here. Okay. Any question before you leave the meeting?
Reflection is due on June 16th, right?
Yes. And then you have a few reflections. Is available. Okay, they are all close to each other each other because and after the chapter, okay, they are related to their chapters, right? Now,
Thank you, Dr. Adam.
okay, see you tomorrow at noon. We will first begin with the quiz and then continue with our new chapter. Okay.
Okay, thank you.
Okay.